Hey future nurses, welcome back to manpreetRN Talks. So in this video, I will discuss about calcium channel blockers. So if you are new here, don't forget to hit subscribe because every week we break down to endless topics into easy exam ready lessons. So today I'm going to discuss calcium channel blockers, one of the most commonly tested cardiac drugs in the NCLEX or OSCE exams, as well as other nursing exams. So, what are calcium channel blockers? So, drug classes with antihypertensive, anti-anginals, and antiarrhythmics. So, common ending like dipin. So, it includes and also like Verapamil, Diltiazem, Amlodipine, Mnemonics. They all are calcium channel blockers. So, and let's tip mnemonics. So, you can remember calcium channel blocker. It's calm the heart. So, calcium channel blockers slow down the heart and relax the vessels and reduce blood pressure. So, mode of action, it blocks calcium channels in the cardiac muscles and vascular smooth muscles that lead to decreased heart rate, decreased myocardial contractility, decreased blood pressure, and as well as vasodilation of the arteries. Some of the examples are amlodipine, nifedipine, Verapamil, Diltiazem. So indication, like as well, you can see it is used in the hypertensive angina and arterial fibrillation or supraventricular tachycardia. So contraindication. So in the severe bradycardia, we cannot give calcium channel blocker because it will also lead to decrease in the heart rate. Second or third degree heart block, PHF, chronic heart failure, and hypotension. Side effects you can remember it is with calcium channel blocker in the GI, constipation commonly with Verapamil and peripheral edema. It is most common and tested on the NCLEX exam. Next is nursing consideration. So before giving, you should check BP and heart rate and hold if heart rate is less than 60 beats per minute and the systolic blood pressure less than 100 mmHg. It is applicable for all as we have discussed in the last video in the beta blocker. So it is also applicable here. And also monitor for edema and signs of heart failure. On most one important is avoid grapefruit juice. So in the NCLEX exam, you should always avoid grapefruit juice, because it increases the risk of toxicity, especially with the Verapamil and Diltiazem. So, and fluid retention risk. So take the patient to report any swelling in hands, feet, or sudden weight gain, and also constipation because it is associated with the Verapamil. So encourage the patient to drink more liquid and fiber and fruits. Next is so NCLEX warning points. You have to remember the whole if heart rate is less than 60 and the systolic blood pressure is less than 100. And do not give it with beta blocker unless closely monitored because it also decreases in the heart rate and the systolic blood pressure. So watch for AV block or worsening heart failure symptoms. So NCLEX practice question. A patient is prescribed Diltiazem for arterial fibrillation, which finding require immediate nursing intervention. So it is immediate nursing intervention. A. BP 100 by 72 nm of Hg. B. Heart rate 54 beats per minute. C. Mild ankle swelling. D. Reports of constipation. So it is in the question as they are mentioned, they require immediate nursing intervention which can immediately kill the patient. So for the option you can see in the B option, heart rate is 54 beats per minute. Because if we give detergent calcium channel blocker to the patients, it also decreases the heart rate. So we should hold the medication and notify the healthcare provider. So option A, BP is 108 by 72. It is when its historic blood pressure is less than 100. So we have to hold it. So A option is cut out. And the C is mild ankle swelling. So mild, it is not as bother immediate intervention. So D reports of constipation as constipation is associated with the Verapamil. So quick mnemonics for the exam. You can remember calcium channel blocker for the word calm. So C for check heart rate and BP before giving medication. A avoid grapefruit juice. L look for signs of heart failure and edema, and monitor for constipation and bradycardia. So that's all about the calcium channel blocker. So if you like this video, kindly share it with your friends and do subscribe this channel for more updates. Thank you for watching it. Stay focused, stay confident, as always, keep learning, future RN.